Namaste. Hi, I'm Abhay Kamdi, yoga sadhaka and teacher. I have been learning for more than 20 years. And about 3 years back, I started my yoga classes after doing my teacher's training from the Yoga Institute. And I have also specialized classes for correcting diastasis recti, which will also be my topic for today as part of the project work for the pre and postnatal yoga and Garbhasanskar TTC by Dr. Nutan. I would like to start with gratitude to Dr. Nutan for creating an awesome course and sharing her knowledge which she has and wisdom which she has acquired over these so many years. And also to my parents and all my teachers and gurus and my wife also who introduced me to Ayurveda as well. So to start off with, what is a diastasis recti? When we talk of diastasis recti, we are talking about the six-pack muscles which are at the front of the abdomen, which all the heroes show of Shah Rukh, Hrithik and all. And if you recall, there are two sets of those muscles, one on the right and left, and they are joined in the middle by a connective tissue known as the linea alba. As the belly expands during pregnancy, there is increase in intra-abdominal pressure, which stretches this tissue and creates a gap between the left-right belly muscles. And this gap is what is called as a diastasis recti. Recti abdominis is the medical term for the six-pack muscles, and diastasis means a space. So if you see the image, the brown part is the six-pack muscles, and the white tissue line between them is the linea alba. It gets stretched as the belly expands. The gap which is formed can be at various locations around the abdomen. Usually it is around the navel, as in the second image, sometimes below the navel, sometimes above, as in the second, third, and fourth images. And at times it is all along the length of the abdomen, right from the ribcage to the pelvis. Now this gap creates certain typical symptoms which can be seen. The most common is the mummy tummy, as it is called in the common language. The tummy which will not go away even after dieting the regular kind of exercises, because it is not belly fat and it is caused due to a weakness in the abdomen. Then the next common symptom is of lower back pain. So because of this spreading of the belly muscles, the core of your body gets weakened. And by that I mean the muscle set of muscles starting from the diaphragm, the core muscles around which wrap around the spine, and the pelvic floor muscles. And due to this weakened core, usually there is lower back pain for most women postpartum. Then again, due to the weakening of the belly muscles, many of the women postpartum feel constipated and bloated. Again, all of these conditions are usually not associated with this diastasis recti because of lack of awareness, especially. And you might tend to take medicines and these which will only provide temporary relief. Again, due to the weakened core, there is poor posture, and then the next symptom, which is that of urinary incontinence. So postpartum, as well as due to diastasis, the pelvic floor muscles also get weakened, which results in this symptom of urinary incontinence, that is on coughing, sneezing, laughing, and inability to hold the urine and lack of control in it. These were the more common symptoms. Apart from that, there are certain rarer but more severe symptoms which can occur, that is of umbilical hernia or organ prolapse. A prolapse is a symptom in which your internal organs such as the uterus, the rectum, or the bladder can slip down from their place, and that may be felt as heaviness around the reproductive organs. The hernia is a condition in which the internal organs on the stomach can poke out through that weakened linea alba and may be seen as a projection on top of the umbilical part, the umbilical area. And hernia usually is unsymptomatic, and sometimes if it gets symptomatic, you will need an operation. And having a diastasis recti increases your risk for these issues, so you should not ignore these conditions and get them corrected. Once you have diastasis recti, certain precautions you need to take. So this condition is caused due to increase in intra-abdominal pressure. So any activity or exercise which increases that pressure should be avoided. That includes lifting anything heavy, even your baby, but that is not avoidable. But so hold in the center with a proper posture. Always avoid lifting anything else heavy, coughing, sneezing. You can support your belly muscles with the hands, particularly if you have urinary incontinence. Always maintain good posture. And lying down, you do not lie down straight on the side, turn to the side, come on the shoulders, support yourself with the hands. Coming up also in the same way. Some of the exercises to avoid, any exercise which creates doming, a typical term in diastasis recti where the belly bulges out, or a coning where a shark-like fin is seen on top of the belly, should be avoided. That includes exercises like planks, crunches, sit-ups, Surya Namaskar, which has a plank and a downward dog in between. Yoga poses, most of them cannot be done. No forward bends, backward bends, twisting asanas. Strictly Kapalabhati to be avoided. The linea alba is already thin. Vigorous movement in and out would further increase the gap or even cause a hernia. So these were some of the exercises to avoid, and now we'll see some of the sequence of basic for DR correction, which I have designed. So start off with a stomach vacuum. It is similar to a Udyan Bhatt, a modified version, where you exhale to the completely the air from the lungs and pull the navel in. This activates a set of muscles called transverse abdominis, which are deep core muscles, and pulls them in, and which helps to correct the gap. The regular exercises which target on the superficial ab muscles are to be avoided, and you have to focus on the deep core muscles to correct the DR. Once you do the stomach vacuum, additionally, you could put more pressure on the belly muscles by doing knee raises, heel slides. And then for Setu Bandhasan, which everyone knows, so it's also a good exercise, develops the core muscles, and also it's good for the pelvic floor issues. Followed by then you can do the Ashwini Mudra in various poses such as Baddha Konasana or Upavishta Konasana to develop the pelvic floor muscles, which will relieve any urinary incontinence issues. At the end, since there is a lot of pulling of the deep core muscles, you can do finish off the session with Supta Buddha Konasana and Shavasana, which will just relax those belly muscles, and the session will any adverse effects will not. Also, it will be good for maintaining the calmness of the mind and the system. Some testimonials from my DR program. Chetna had DR since 3 years. Within 2 months, she completely closed her ER gap, which was about 2.5 fingers, lost inches from her tummy, and also got rid of her back pain and urinary incontinence as well. And these are her before-after images. Also, there is one other woman who had back pain and was wearing a belt for more than 10 years, and she could not, because of a back pain, she had got used to the belt so much. And within a few months, now she's off her belt, and recently she even went to an outing and did not wear the belt at all. Yeah, so those are some of the testimonials. And so thank you for your attention, and thank you once again, Dr. Nutan, for providing this opportunity. And all of the participants in the program, it has been wonderful to listen from you, and it's a good revision, and your slides and all are so professional. Thank you so much.